This is an overview of the Jefferson County Intellectual and Developmental Disabilities Program. My name is Bonnie Obremski, and I'm the Intellectual and Developmental Disabilities Coordinator for Jefferson County. Nationwide, rural regions like Jefferson County have higher densities of people living with disabilities of all kinds than in urban regions. In Jefferson, nearly 3,000 people identified as having a cognitive difficulty. Of those, some would further identify as having an intellectual and/or developmental disability, referred to as IDD. Those disabilities originate before age 18, continue indefinitely, and cause substantial limitations. In Jefferson, 152 people experiencing IDD are enrolled with the State Developmental Disabilities Administration, referred to as the DDA. Of those, 118 are accessing DDA services. That's a high percentage of access. In fact, it's the second highest in the state. There are many DDA services available. 3 of those services are overseen by county governments. They are community inclusion, supported employment, and birth to 3 services. Counties contract with providers to ensure quality local service provision. Supported employment providers help people with IDD prepare for, find, and keep jobs. There are 2 categories of supported employment: group and individual. Employment supports for high school students are called transition services. Individual supported employment has the highest number of participants of employment supports.
My name's Emma McAdam. I'm 22. I work at Cooper Mercantile, Mondays and Wednesdays. I was really excited to work with them. It feels really good to be an adult. Being out of high school is a big step for me, you know? I do retail, actually. I hang up clothes, recovery and dusting. I also get to operate their computers. I work with Pierre, Bonnie, Molly, Rachel. They're all very nice. I feel happy when I work with them. I love it there. Yeah, it's my home.
Learn more about services for people with intellectual and developmental disabilities at Jefferson County, Washington Public Health.
Transition services for students 14 and older prepare them for the transition from school to life as a working adult. A provider may help document a student's support network skills and desires, assist with job applications, help stabilize a student in a job, and more. The county only oversees transition services called Job Foundation and School to Work. Other entities manage other transition services and have different eligibility requirements. In the coming years, the state anticipates 2 or 3 students in the county will be eligible for those county-managed DDA transition services. It bears mentioning that other kinds of transition services available in the county have higher numbers of eligible participants. Community inclusion is another DDA service. It provides opportunities for people with IDD to find community with other people who share their interests. 44 people access community inclusion in the county currently. In Jefferson, there is just one provider of these DDA services, Cascade Community Connections, based in Port Townsend. Birth to 3 services are for children up to age 3 who face developmental delays. Services may include occupational and physical therapy, speech and language therapy, and many more. There are 9 children enrolled for state-funded birth to 3 services in Jefferson County. There is 1 provider of birth to 3 services in the county, Concerned Citizens. As the county coordinator, I am required by the state to continuously seek additional qualified service providers. The state also requires me to make sure providers are meeting state standards. The state asks county governments to adhere to a set of guiding values when performing work in order to support the state's mission to make sure people with IDD are included, safe and supported, and have the ability to make their own choices. Here's a funding overview. State funds flow into the Department of Social and Health Services, or DSHS. I want to note that some state funds flow through the Department of Health to fund the county's School Medical Autism Review Team, which helps children connect to local providers for assessment for autism spectrum disorder. So back to DSHS. Funds then flow from there to the DDA and DVR. Here's a side-by-side comparison of those two departments. DVR provides shorter-term, job-focused services for people with any kind of documented disability or health-related barrier. DDA offers a range of lifelong supports specifically for people with intellectual and developmental disabilities. DVR and DDA funds flow into several entities serving Jefferson County. Only a portion of the funds flow into the county's IDD program. There are also other county-managed funds and resources that support the county's IDD program, which may include limited or shorter-term funding sources. Here's how the county distributes funds. Most pay the county's sole state-qualified provider of supported employment and community inclusion. Funds also support my role as the coordinator. Smaller amounts support local chapters of statewide organizations that support people with IDD and their families. To review, my job is to manage contracts and perform quality control measures. A third task I have is to manage the Intellectual and Developmental Disabilities Advisory Board. The state requires counties to maintain an advisory board to ensure local people with special knowledge of IDD are informing county decisions. I also manage the Accessible Community Advisory Committee. That committee helps citizens apply for a state grant to improve accessibility throughout our community. In my role, I also support efforts to educate the public about IDD services. I do that with the help of more than a dozen primary partners and more than 40 additional partners throughout the region and state. I also work in partnership with many of my county coworkers. So thank you for taking the time to learn about this county resource. I welcome you to reach out anytime for more information. Thank you.